Hello, back again, Dr. Coring, coming at you guys once more for another episode with Real Health Talk with Dr. Coring. Today, I'm going to switch it up just a little bit. Today, I'm going to talk about a trending health topic. It was brought to my attention um, of the concern for Ozempic causing cancer. Someone close to me brought this to my attention, and therefore I would like to share it with you guys. So, for those who do not know me, my name is Dr. Coring. I am an internist by training and trade, also a pharmacist by training and trade, who is now currently in a hematology oncology fellowship training to become an oncologist. And it is my passion and also my pleasure to educate common folks around and regarding common diseases as well as health topics. You see, it's my goal to make our community more health literate, to close the health literacy, to close the health illiteracy gap. And in order to do that, it is my plan to make information, relevant healthcare information, readily available in a easily understandable way. So today we're going to talk about Ozempic and its risk for causing cancer. And so let's start by addressing what is Ozempic. Ozempic is a medication that was approved by the federal government in 2017 to treat type 2 diabetes as well as weight loss, obesity, essentially. And so we also prescribe this medication for patients whose BMI is greater than or equal to 30 and or patients who has a BMI greater than or equal to 27 with one or more additional risk factors that can cause cardiovascular disease, such as hypertension, diabetes, hyperlipidemia, and or heart failure. And so these medications work really well. And just so you guys can understand, Ozempic is the brand name for a medication or a compound called semaglutide. And so semaglutide is branded under the name Ozempic, Rybelsus, as well as Wegovy. So these three brand names mean semaglutide, essentially. That's the compound that was approved by the FDA in 2017 with the warnings on the label. So the information that I'm giving you is directly from the package insert that was approved by the government as well as the company itself. So the warnings for this drug: pancreatitis, diabetic retinopathy, and acute kidney injury. What does that mean? Basically, there's the information, or the government or the manufacturer is warning you that this medication can cause inflammation or irritation of the pancreas. It also can cause basically eye disease, diabetic retinopathy. So they're warning you against eye disease, as well as acute kidney injury. So this medication can potentially injure your kidneys. However, there is a more severe warning that's been issued regarding this medication by the government. And this severe warning is considered a black box warning. And what does a black box warning mean? It simply means that the government is requiring that the manufacturer, Ozempic, issue a serious warning patients and or prescribers regarding a potential catastrophic event that can happen if taking or while taking this medication. And what is the serious warning for this medication? Well, it seems as though the government has issued a black box warning or a serious warning against or the risk for thyroid C-cell tumors. Yes, the government is saying that this medication can potentially put people at risk if taking this medication for thyroid C-cell tumors or thyroid cancer. And I'm going to read you guys the black box warning verbatim. Warning: risk of thyroid C-cell tumors. In rodents, semaglutide causes dose-dependent and treatment duration-dependent thyroid C-cell tumors at clinically relevant exposures. It is unknown whether Ozempic causes thyroid C-cell tumors, including medullary thyroid carcinoma, in humans, as human relevance of semaglutide-induced rodent thyroid C-cell tumors has not been determined. Ozempic is contraindicated in patients with a personal or family history of medullary thyroid carcinoma or in patients with multiple endocrine neoplasia syndrome type 2, i.e., MEN2 syndrome. So, what does this mean? This simply means that the government is saying we are not sure, but when this drug was studied in mice during the clinical trials, the pre-human clinical trials, we did notice that when this drug was given to mice in the clinical studies, that at various doses, escalating doses, that these mice were getting tumors, specifically in their thyroid. However, when these studies were done on humans, we did not see that, or this was not observed. But we cannot be sure that this cannot happen or this would not happen to humans. So therefore, we're going to issue a warning, the most extreme warning, which is the black box warning, simply saying that we're not sure, but this drug may and can cause thyroid cancers. We definitely seen this happen in rodents. We did not see it happen in humans, but we can't say there's not a potential. In addition, we think that people who have risk of medullary thyroid cancer, personal risk or family risk, and also people with a history, specifically patients with a history of medullary, or we call this multiple endocrine neoplasia, MEN2 syndrome, should not take this medication. There's a contraindication in this patient population. So what I would like to do is spend the remaining time, I have about 3 minutes left, talking about essentially thyroid cancer, specifically medullary thyroid carcinoma, as well as multiple endocrine neoplasia, MEN2 syndrome. Because these things may become unfamiliar or may seem unfamiliar to you guys. So that's what I would like to spend the rest of my time discussing. So let's talk about medullary thyroid carcinoma, which is a rare cancer. Essentially, this cancer is or will cause a tumor directly in the thyroid. And you will have symptoms. Basically, when this cancer arises, you will have symptoms with trouble swallowing, as well as trouble talking. And so difficulty swallowing, difficulty talking, also diarrhea. This can cause diarrhea as well. And so definitely be on the lookout for diarrhea. And so those are the primary symptoms of medullary thyroid carcinoma. Now, I will also like to discuss multiple endocrine neoplasia as well, too, especially because there's two subtypes. You have multiple endocrine neoplasia 1 and then multiple endocrine neoplasia 2, which is a hereditary cancer. So what that means is that this cancer has to be passed down to you from your family. It's a genetic cancer. So that's what I mean when I say it's hereditary. So it's a hereditary inherited cancer, very rare. Only 1 in 35,000 people have this type of cancer. And essentially, it's a syndrome. So a syndrome of cancers. People with MEN-2, multiple endocrine neoplasia-2, are at risk of having tumors in the thyroid, a tumor in the parathyroid gland, or a tumor in the adrenal gland. And so basically this is a syndrome consistent with one of 3 cancers. Typically people can acquire, we already talked about medullary thyroid carcinoma, so that's a tumor within the thyroid, but there can also be a tumor within the parathyroid gland called parathyroid hyperplasia. That's also a component of MEN-2. And then also there can be a tumor within the adrenal gland called pheochromocytoma. And so let's go over the parathyroid tumor, or the hyperplasia, or the parathyroid hyperplasia, because we already discussed the medullary thyroid carcinoma. So the second part, or the second cancer, is a primary hyperplasia. This can happen when you have a tumor within the parathyroid gland, and that can cause excessive calcium inside the bloodstream. And the symptoms of this would be muscle joint pain, constipation, fatigue, memory loss, as well as kidney stones from all of the calcium being deposited or secreted into the bloodstream. And so that would be the parathyroid hyperplasia component. Now, there's another tumor that can happen with men-2, which is pheochromocytoma. Now, this is a tumor that manifests as too much adrenaline that will be secreted into the bloodstream. And too much adrenaline, meaning too much norepinephrine, can manifest as hypertension, elevated blood pressure, tachycardia, elevated heart rate, anxiety, and headache. If you're experiencing these symptoms intermittently or off and on, that can be a manifestation of pheochromocytoma. I just want to reiterate, this is a rare disease. Only 1 in 35,000 people are affected with this disease yearly. So that's the incidence rate. And so it's a rare disease. However, if you were diagnosed with men-2, which manifests as either a tumor in your thyroid, specifically medullary thyroid carcinoma, a tumor in your parathyroid gland manifesting as parathyroid hyperplasia, or a tumor in your adrenal gland manifesting as pheochromocytoma, then if you have this syndrome, then Ozempic is not for you. That drug is contraindicated for you, simply because if you take the drug, then you are at risk of having, or putting yourself at risk of acquiring medullary thyroid carcinoma, which is a component of men-2. So that's the warning here, and that's the warning of this video. You are at risk of medullary thyroid carcinoma because you have a family member who have medullary, or been diagnosed with medullary thyroid carcinoma, or a family member who have been diagnosed with one of the 3 tumors that I mentioned. The tumor in the adrenal gland, the pheochromocytoma, the tumor in the parathyroid gland, parathyroid hyperplasia, or the tumor in the actual thyroid gland itself, medullary thyroid carcinoma, then Ozempic may be contraindicated in you because of your family history. And so what I would advise people to do is make sure that they understand and are well informed of their immediate family history, meaning mom and dad, as well as sibling history of thyroid cancer, parathyroid cancer, and adrenal cancer or adrenal gland cancer. That being said, Ozempic may not be for you because of the contraindication that I just mentioned. And so therefore, understand that there's a black box warning. The black box warning is warning you that this drug has a risk potentially of causing thyroid cancer, and that warning should be taken seriously. And so therefore, if you yourself have a history of thyroid cancer, and or have a family history of thyroid cancer and cancer of the adrenal gland or the parathyroid gland, then you should make sure your healthcare provider understand that history, and therefore shared decision making should be made before this drug is prescribed to you to alleviate or mitigate the risk of medullary thyroid carcinoma. That's my time, folks. Sorry I was so long-winded, but definitely wanted to get that public service announcement out there that Ozempic does put certain patients at risk for cancer, specifically medullary thyroid cancer, especially if you have a strong family history of MEN2 syndrome, and or if you have a history of thyroid cancer. Definitely should be aware of this black box warning that's given with Ozempic. Thank you. That's my time. Peace and love to you guys. Talk to you later. Bye.